Hi, everybody, and welcome to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJ at Exchange Place. And today I have a very special guest for you. But at first, I want to introduce my co-host, Dr. Akunyili.
Hello, everyone. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. We're very excited today to have Dr. Sydney Asselstine with us.
Yes. And again, she's going to add a very dynamic mix because she does primary care and she also does some sports medicine, which I think is kind of very unique because especially as primary care, we do a lot of exercise, diet, lifestyle modification and so on and so forth. But she's actually certified in living it. So it actually adds a very special twist to what she does. And I can't wait to see what she has to say.
Absolutely. It's unique and complementary, and she can bring a lot of wealth of knowledge in sports medicine, exercise recommendations. We'll talk to her about some sports-related injuries. So looking forward to it.
Yeah, especially concussion. I mean, I think concussions are something, especially young parents and so on and so forth with their kids in sports. It's a big deal right now, and we see it even in professional sports, how they're addressing it. So now we have an expert, and I can't wait to hear what she has to say.
Absolutely. I see a lot of that as an emergency medicine physician. And then, sports medicine is also working with sports teams, right?
Yeah.
You hear about cardiac arrest in the field, et cetera. So it's a whole gamut. Very excited to have Dr. Asselstine with us today.
And I think she's going to talk a little bit about arthritis, which I'm interested in hearing what she's going to recommend. See what's
yes,
different than what I recommend. So.
Okay.
Anyways, let's go bring her. We'll be right back.
We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And I have with me my co-host.
Hi, my name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place. So we have Dr. Asselstine coming in today to talk to us. A little bit about sports medicine, primary care, prevention. It's going to be interesting.
So, something you and I have talked a lot in the past is how, and this as a primary care doctor, how important prevention is. And maybe as a healthcare industry, we haven't really spent as much time as we should focus on preventative health. How do you prevent people from getting sick? And while I'm an ER doc, I still don't want people to get sick and come to the emergency room. And what's the role of primary care in keeping people healthy over the course of their lives?
No, exactly. And again, a lot of the preventive stuff that the patients need to do and, all the preventive measures that they need to have. But again, a lot of the diseases, as you know, especially in primary care, a lot of it is actually lifestyle modification. It's really the starting point, is the lifestyle modification, the watching what you eat, exercising properly. I get it a lot in my practice, about, well, I don't have time to exercise. Well, nobody really has time for that. But unfortunately, you have to make time because disease will make time for you. So it's going to be interesting to see what she recommends. I'm sure she adds a very special twist because she does sports medicine as well.
Absolutely. And then something else that, we don't really focus, at least when I trained, it wasn't part of the curriculum at all, was the mind-body connection. Right. So I do want to ask her about stress.
Yeah.
Right? So we hear so much about people being stressed, the stress of everyday life, which gets worse with the economy, transportation, you name it. How does that affect people's health, and what are the, we can't obviously change the universe, but what tools can we give them to be healthier?
And especially in our era nowadays, because, we're in the post-COVID era, a lot of patients were very traumatized by the
Yeah, of
whole
course.
COVID thing, not being able to get a lot of their screening tests,
Losing loved ones.
Yep, gaining weight, for example. So, we're going to be talking with her about all that. I'm very interested in knowing, especially, for example, about the concussions,
Yes.
because that's a big deal. And again, I do primary care, and I do have young patients in my practice, but not as much as her. I really want to see what she recommends, and I think it's a real asset, actually, to have somebody like her in this community. There's a lot of sports that actually happen here in high school, even collegiate and so on and so forth. So I'm very interested to see what her talk is about concussion and so on and so forth as well.
Yeah, and I understand she's actually the team physician. We'll let her speak for herself, obviously, for some of the local teams or maybe even a big football team in this area.
Yeah.
I'm not a big football fan, but when you say Rutgers football here, everybody knows and pays attention.
Oh yeah, we know what you're talking about.
Yes.
Absolutely. So, and again, we're going to be having the summer come,
Yes.
which a lot of activity and so on and so forth. So it's going to be interesting to have those conversations with her.
Well, we also want to ask her about, like we always do, the people that work with her. What was the role of physical therapy? What's the importance of recovering concussion? What can we do? I'm particularly interested because I see so many patients that want me to give them a prescription, right? What should we do? Those guidelines keep changing.
Yeah, I, in my practice, get a lot of times, I get a lot of things for physical therapy and so on and so forth. So hopefully she's going to go over all that.
All right.
So we're going to take a quick break,
We'll be right back.
and we'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Hi, everybody, and welcome back to Hudson Health. My name is Dr. Angel Lazo with RWJ Barnabas Health, and I'm here today with my co-host, Dr. Akunyili.
Welcome back, everyone. My name is Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, and we're here with Dr. Sydney Asselstine, who is a primary care and sports medicine physician. Welcome.
Thank you.
Please tell us about yourself and what you do for RWJ Barnabas Health.
Yes, thank you for having me. I'm a primary care trained physician with added certification in sports medicine. Did my training out of Rutgers University and happy to be part of the RWJ Barnabas Health system still. I work out of Greenville Primary Care in Jersey City, and then I also serve as a team physician with local high schools, New Jersey City University, and I volunteer with the Rutgers football as well.
Very interesting. So tell us a little bit about, again, it's kind of like a dual role, primary care, and then you do sports medicine. So tell us a little bit about primary care. What exactly does that mean? What is it?
Of course. So primary care encompasses a lot of aspects of medicine. It's kind of the full spectrum. We do a lot of preventative health measures and screening exams and trying to keep you as healthy and active as long as we can throughout your lifetime and managing your chronic conditions. And with that comes coordinating with specialists when we need to bring in a little more expertise as well.
So it's interesting, you talk about preventative medicine, and that's everybody's sort of thinking about these days. How can we get people to be well and not sick, and how can we drive that? So tell us more about preventative health and screenings, and what kind of screenings do people need at different phases in their lives?
Mm-hmm. Exactly. So preventative medicine, it's trying to be proactive so that we can either prevent or catch a disease early on and improve those outcomes for our patients. So depending on different phase of your life, there's different screenings that you might take part in. For women, classically, you might think of pap smears starting from in your 20s, and as you get older, you think about your mammograms, bone density screening exams. For both males and females, you also need to think about colorectal cancer screening. But beyond that, everyone really at their annual preventative exam is getting some aspect of preventative medicine. So even though you may not be sent for a specific test, you're getting your blood pressure checked, you're being screened for mental health disorders, you're being screened even for socioeconomic factors that can influence your health, like access to food, for example. So those annual exams are very important from a family medicine standpoint.
But you had a very special twist because it's not just family medicine, but you also do sports medicine, of which the staple for us in primary care is really exercise and diet. So you had a special twist to that, I would imagine. What do you recommend as far as like diet and exercise?
Right.
It's probably different than what I do as a primary because you're a little bit more involved. So it's interesting. I want to hear it.
Yeah, I do feel that the specialties complement each other in that sense. In terms of exercise, there is the recommendation that we get 150 minutes every week, but what does that look like for every person? It's very individualized. So having the sports medicine background, I like to try and come at it from an exercise prescription approach and tailoring specifically to each patient and what their medical concerns may be, the type of exercise they should be doing, the amount that they should be doing each week, and helping them to set target goals. And then from the dietary standpoint, it's also very individualized as well. There's no cookie cutter, one answer, what diet we should be following. So again, taking into account those chronic conditions, working with our ancillary services in nutrition, working with even our health coaching and things like that as well, and involving full team approach.
So I like what you talked about, diet and exercise, but there's something that even when I trained and I'm an emergency physician, we didn't really learn as much about the effects of stress on overall health. So how do you approach that, and what do you advise your patients in terms of stress and reduction, and how does it affect health in general?
Yes, stress, there's a huge mind-body connection, and so reducing our stress can help reduce our risk for many chronic diseases. And so I do like to come at it from kind of a similar approach and encourage exercise, encourage proper diet, but also mindfulness and meditation, breathing techniques can go a long ways, getting a full amount of sleep, and really just talking to the patient about what works for them, what do they enjoy doing, how can they find time in their life to de-stress, because whatever I say can, go in one ear and out the other. But if you individualize it towards the patient and what they enjoy and what their goals are, then I think you get a lot more out of it.
Right, it becomes less stressful, no pun intended.
Exactly. I don't want to give them a to-do list on top of what they already have going on in their life.
And again, we only got probably less than a minute, but tell us a little bit about the sports medicine piece that you do. Are you dealing mostly with younger athletes? Any specific programs that you're working with? You mentioned Rutgers. Tell us a little bit about that.
Yeah, so in the office, it's a lot of either overuse injuries, arthritis, kind of weekend warriors, as you might call it. And then I also, do work on the sidelines with high school football, Rutgers football. So that's a lot more of acute injuries, dealing with having to be prepared for those more emergent situations as well, because it's not just the musculoskeletal, it's the cardiac, it's the cervical spine, everything like that.
Excellent. Well, thank you very much. That's excellent. And we're going to head for a break, but we'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address. the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm here with my co-host.
Yeah, hi, my name is Dr. Angel Lazo. I'm with RWJ at Exchange Place. And we have a very special guest today. It's Dr. Asselstine, who's sports medicine as well as primary care. Now, the last segment we were talking a little bit about sports medicine, so let's talk a little bit more about that. Elaborate a little bit more about the sports medicine piece.
Especially about concussions, right? That's everybody's talking about that, especially with summer games and football, etc. So tell us, what is a concussion and what are the signs and symptoms? When should people seek help?
Of course. So concussion essentially is a mild traumatic brain injury, basically. It is when you have an injury to your brain after either a direct blow to the head or an indirect blow. So a lot of people forget about that aspect, that it can come from being hit to the body, and then your head has these forces that are traveling to it that can cause consequences. And so people after that may experience things like a headache, they may have sensitivity to the light, sensitivity to sound, difficulty concentrating. They just don't feel like themselves. And if anyone, should experience that after a possible head injury, that's really something that they should be seeking medical attention for.
And how long after would you say are they safe? You sustain a concussion today, are you okay roughly? I mean, it depends on the grade of the concussion, but overall, is it still lingering months later? Or?
It really depends on each individual person. Some people may feel back to normal within a week, and some people it could linger for months. But that's why, when you establish that care and you follow with a provider who's trained in concussion management, they're able to really track you through the process and make sure that you return to work or return to play safely.
Excellent.
So what should people do to prevent concussions besides avoiding impact? What should they do primarily? And if they do have a concussion, what can they do to get better faster?
Mm-hmm. Well, from the prevention standpoint, especially with sports, whether it be an elite athlete or just your average weekend warrior, you really do want to be using the proper protective equipment and following the rules. They're there for a reason. They're there for your protection. Even in places like on the job site, follow those rules, make sure you're wearing your protective equipment. There's also research out that looks into neck strength as a way to prevent concussions, as well as neuromuscular training in athletes. So there's different exercises that can be done to help try and prevent it as well. From a recovery standpoint, it's no longer a disease, injury where you just go sit in the dark. Right. That used to be, go home, sit in the dark for a week, you'll get better. But now there's things that we can do to try and help expedite that. So we look at your symptoms, we create an individualized approach. If you're having a lot of neck pain, we might refer you to physical therapy. If you're having a lot of dizziness or vision problems, you might need some ocular therapy, eye therapy. And we can give you even exercise to do. So light aerobic activity now, earlier on in your recovery, can help promote a quicker recovery, reduce prolonged symptoms. And so that has to be very tailored to each individual person.
Now, what about, aside from concussion, let's talk about arthritis, osteoarthritis, and so on and so forth. Tell me what part of that is your practice, so to speak, in sports medicine and whatnot.
Yeah, so especially since I'm also with the family medicine side of things, I think I see a lot of that aches and pains coming into the office, and it's nice to be able to jump on that right away without having to send people all around. And so there's a lot of arthritis that will come up, people complaining of joint pain, swelling. They may or may not have had some type of injury in the past to provoke it. And so being able to get them into physical therapy, get them the appropriate pain management that they need to help deal with that is important.
Now what of physical therapy? I know you mentioned that. Can you just tell us more about the role of physical therapy, and whether it's in concussions or osteoarthritis? I know you work hand in hand with a lot of physical therapists. Tell us more about the role they play.
Mm-hmm. So physical therapy, very important for helping correct muscle imbalances, strengthen the muscles that are supporting our joints, help to improve our flexibility even as well, to take some stress off of the joints. And it's not something that's going to happen overnight. People really do have to understand that it takes a few weeks to even start to build a little bit of that strength. And so it is something that's a consistent process, but working hand in hand with our physical therapists, that is the best way to maintain your quality of life and to help prevent disease progression as well. And then from a concussion standpoint, it can help as well with mitigating some of those symptoms, and the physical therapist is who would help you with that ocular rehab, where you're helping with your eye tracking movements as well.
And what age group do you see in your practice? In other words, what's the starting point in your practice?
In my practice, we are 18 and up, but from a sports medicine standpoint, I'm also working with more youth populations as well.
Oh, excellent, excellent. That's great that you're able to offer it to the community, not just primary prevention, but you have a lot of insight into a lot of these so-called physical ailments that, even I as a primary am not so familiar with. So that's excellent that you're able to provide this. But thank you so much for coming, and we hope to have you back one day. We're going to take a short break, and we'll be right back.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just 1 pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, everybody, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health. And I'm here with my co-host, Dr. Akunyili.
Hello, everyone. Welcome back. My name is Dr. Ije Akunyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. That was such a treat with Dr. Asselstine. It was so enjoyable to listen to a primary care and a sports medicine physician.
What a gem! What a gem for the
Yeah. I'll
community.
let you take your takes.
What a gem for the community. I mean, it's just incredible. Her demeanor and her expertise. I mean,
Yes.
it's so warranted, especially in this area. So not only she does primary care and so preventive medicine, but she also does sports medicine. And there's such a need and such a lack. Her talking about the concussions, which I was really interested in hearing.
Yes.
Very astute. Yeah, very, very, very informative.
So I really, as an ER doc, I really wanted to know the newest guidelines and what people should do for concussions. Really interesting that she said it's no longer a disease where you go sit in the dark. Yeah. It's not a cookie cutter. She kept talking about that it's a very individually tailored algorithm, which could include physical therapy, ocular therapy, movement therapy, just things to get you back to playing and functioning at your baseline.
And again, in her expertise, especially being a primary care, family doc, so on and so forth, you do deal with a lot younger patients that actually end up with these problems. I have several patients in my practice whose kids, they always come to me, for advice, but again, I'm not a pediatrician. I have to treat 18 and above. But now I have a resource that I can actually go to, which is fabulous for this community.
So talking of resource, I was really fascinated. She talked about preventative medicine and how her job was is not just as a primary care doctor, as a sports medicine doctor, was to get a prescription, if you will, including an exercise prescription, diet recommendations along with her nutritionist, lifestyle. And there wasn't one thing for everybody. So I don't know, you know, you and I sometimes we end up going to a doctor, right? And you get a list of to-dos and you're more stressed. But just knowing that this is for you, right? Even if you recommended to have 150 minutes of exercise, but maybe you can only do 60. Well, you start where you are. And that, I think, is so important for us to think as we advance healthcare beyond just sick care.
Yeah. And it's the whole mind and body connection,
Yes.
you know, that she basically spoke about, you know, and how stress especially adds so much to our lives. I mean, we already know that clinically, for example, with type A personalities that are more likely to for heart disease and so on and so forth. But it's a very interesting twist, especially what she had, because, for example, with my patients, you know, when you talk, you know, you do the routine, you talk to them about the lifestyle modification, exercise and diet, and, you know, they start with, well, I got a bad knee and so on and so forth. Well, good luck with that with her, because she's going to tell them exactly what they need and so on and so forth. So she's a great resource for this community.
It's exciting. And she does work for the Rutgers football team. So she works with some of our local teams and young people. I think that's very interesting that she gets to do both.
Very interesting. Absolutely.
Well, something you and I talk about almost every episode is access to care.
Yeah.
And not only is Dr. Asselstine one of those points of access for our community, there's several like her doing primary care. And we're going to talk about emergency medicine in another segment, but having people able to go to their doctors, whether it is for routine screening. She did even say that even if you're not doing a test, every yearly visit to your primary care doctor is a screening test.
And again, her emphasis again was exercise as well. You know, the lifestyle modifications are really cardinal and paramount for a lot of what we do. Otherwise, you end up in the emergency room.
So you're the primary care doc, but I can say this as an ER doc, but when you tell people to exercise, they think you're probably telling them to go out and run the Jersey City Marathon.
Yeah.
Nothing could be further from the truth, right?
Correct. That's correct.
So, you know, start where you are. Perhaps exercise is just a walk around the block.
Yeah, I mean, I recommend, and again, she went over some of the guidelines and so on and so forth. You know, when I talk to a patient, I tell them you should do 150 to maybe 300 minutes of exercise, which ends up being, you know, half an hour to an hour, at least 5 times a week, or do pacing, you know, the 10,000 steps. Just about everybody has a phone or they have a Fitbit. You know, I personally say, well, you can't walk, you know, you can't do exercise at the gym, you don't have time. You know, but exercise, you have to find time for that. And if you're able to at least pace yourself and see how many steps, and you do at least about 10,000, then as an adult, you're basically meeting the requirements for exercise. And these are the things that she discussed with us and we discuss with our patients.
And every little step counts.
Yes, it does.
Literally.
Every little step. Otherwise, you're going to end up stepping into the emergency room.
Oh. On that note, that was very exciting that we had her, and we look forward to having more conversations with her. I think we need to bring her back.
Absolutely.
You know, we talked a little bit about concussions. We started arthritis. I want to hear more about osteoarthritis and the weekend warrior injury. She alluded to that.
But we'll bring her back. But thank you very much for joining us today. And we'll be leaving now, but make sure you watch us next time here at Hudson Health.
And get your steps.
Yes.